Metabolism is defined as how your body processes sugar and how the cells in your body gain the energy and use the energy that it has from things that you eat or energy that your liver produces to run its functions. When your body is significantly overweight, your body believes that there's inflammation going on. Your white adipose tissue, belly fat if it were, has the ability to recognize free fatty acids that are in high concentration there as a pro-inflammatory environment. And as a result, you see a lot of influx into that tissue of immune cells. And when those immune cells are acting as in a pro-inflammatory manner, they release cytokines, things like TNF alpha and IL-1 beta, which are your prototypical pro-inflammatory cytokines. And the effect that has on your body is multifold. One is that it causes your liver to produce significant amounts of excess sugar. So you'll see high levels of sugar in your bloodstream. The second thing it does is it reduces the ability of your muscle cells and your fat cells to take up that sugar. The ways that your muscle cells and fat cells absorb sugar for energy is through insulin and the insulin receptor and through the incorporation of that sugar into the cell. The presence of inflammatory cytokines externally as well as internally within the cell causes your cells to protect themselves to create a group of proteins called suppressors of cytokine signaling, or SOX proteins. Two important ones, are SOX1 and SOX3. When those proteins are created inside the cell, they have the ability to break down the cell's ability to take up sugar. And it does that by effectively breaking the insulin receptor. So what happens is your body in this inflammatory environment starts creating lots of sugar internally through your liver, but the muscle cells and fat cells are unable to take it up. Now, the reason for that is because the body thinks it's under attack and it needs to marshal all of its resources to the immune system and to nerve cells in order to keep you alive. Those two cell classes have the ability to take up sugar or take up glucose from your bloodstream without requiring insulin. So by breaking the other cell's ability to take up sugar, it reserves all of that sugar for your nerve cells and your immune cells. The practical upshot of this is that you become insulin resistant and you have high levels of glucose. You become glucose intolerant. Ultimately, what that leaves your body with very few options of ridding itself of the excess sugar. And so your bladder and your kidneys and your bladder will ultimately excrete sugar through your urine, which is a telltale sign of type 2 diabetes. The other thing that happens with those high levels of sugar in your bloodstream is that your proteins that are floating through the bloodstream and are needed end up getting glycosylated, or high levels of sugar attaching to those proteins and ultimately damaging those proteins. We measure that through HbA1cs, or hemoglobin glycosylation levels. If they're over 7, that means you have over 7% of that hemoglobin is glycosylated to a level that's damaging. What vagus nerve stimulation can do is offer an alternative way to reduce the level of inflammation that your liver sees, that those fat cells are seeing, and that those cytokines like TNF alpha and IL-1 come down. So vagus nerve stimulation has the ability not necessarily to make you weigh less or not necessarily to impair the normal functions that are going on, but it prevents the pathological levels of inflammation that lead to that metabolic disturbance that is associated with type 2 diabetes.
You can follow Mr. Errico's work by visiting the Health Upgrade podcast that he conducts along with Dr. Nawaz Habib.